Hi, are you Margaret?
Yes.
Hi, I'm Dulce. I'll be your student nurse today.
Okay.
Do you mind if I follow you around?
Not at all.
Okay. Do you have a patient in room 622?
Yes, I do.
Can I get a report on him?
Yes, you can. The situation is his name is Ronald Jarvis. He's a 67-year-old male. He's a full code with no known allergies. He is a non-smoker, and his doctor is K. Phillips, MD. He was admitted yesterday for a non-healing diabetic wound on his right heel, and he was also complaining of increased blood glucose readings with readings well into the 300s. He has a 20-year history of diabetes, type 1, and he had a transurethral prostate resection 5 years ago, but other than that, he denies any other significant injuries or illnesses. His assessment, his vital signs, blood pressure was 128/70, pulse was 76, respiration 16, his temperature was 98.4, and he's breathing off of room air with a pulse ox of 96%. He's alert and oriented ×3. His Perla was good. Denies any problem with vision. 20/20 vision with he does wear glasses, but reports no problem with them. He does admit to tingling in his bilateral lower extremities, which has worsened over the past 3 months, but denies any memory, speech problems, no problems with headaches or dizziness. For respiratory, his breath sounds were clear bilateral, no coughing, his breaths were even, smooth, unlabored, and denies cough, dyspnea, or chest tightness. His heart sounds were good, no chest pain, no palpitations, no dyspnea, and no edema, and no claudication. His bowel sounds were active ×4, soft, non-tender, reports no pain, no trouble with bowel movements or urination. His urine's a normal color. He has no trouble with sexual functioning. He weighs around 171 pounds, which has remained constant. So he reports no weight gain, no weight loss. So we'll have to keep an eye on that. He is on an 1,800 calorie diet, but is asking for further teaching with that. So we'll need to talk to the patient about that. Other than the wound on his right heel, his skin is good, warm, dry, and intact. For his labs, his current blood glucose reading is 242. So we will have to, I'm going to be administering 2 insulins for him actually, if you'd like to come in and watch.
Yeah.
His fasting blood glucose was 310. His hemoglobin A1C was 6.5%. His calcium was 7.4, so that's low. We'll have to keep an eye on that. His ALT was high at 38. His hematocrit was at 41.2%, which was a little low. And his red blood cells were low at 4.5, so we'll have to keep an eye on his lab values. He has he has an IV in his right median vein in the forearm, but that looks good, no redness or irritation. Let's see. So, my recommendations would be to continue monitoring the blood glucose levels, his vitals every 8 hours. He did have a urinalysis, but we're waiting for the results, so keep an eye out for the pending results. That's about it. Monitor for signs of hypoglycemia is important too. Do you have any questions?
Yeah, you said that you were administering 2 insulins?
Yes.
Okay. Why specifically is this client receiving this medication?
Well, he is a type 1 diabetic, so he is insulin dependent. Yes.
And what action does the medication have on the body?
The insulin will stimulate the uptake of glucose in the body, and it inhibits further glucose production.
Okay. When should you question administering the medication?
If the client is showing signs of hypoglycemia, if their blood glucose level is low.
And does the medication have a therapeutic serum level?
No,
Which vital signs must be monitored?
all of them. So blood pressure, pulse, respirations, temperature, pulse ox, and blood glucose levels.
Which physiological parameters should be monitored when the medication is being administered?
Lab values, blood glucose level, mental state, strength, and vision.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Making sure they're rotating injection locations on the body and the sites within the locations. Making sure they're aware of the signs of hypoglycemia.
And what interventions must be taught for taking the medication safely at home?
At home would be the same as in the hospital, rotating injection sites, not sharing the insulin or needles, or syringes, making sure they're storing the insulin properly, and monitoring their blood glucose levels.
So those are the interventions that must be done to take safely at home?
Yes.
Okay. And what are the side effects and potential adverse reactions?
Side effects may be some erythema at the injection site, possible lipodystrophy if they're not rotating properly, and then potentially hypoglycemia.
And how will you know the medication is effective?
You'll know it's effective by looking at their blood glucose levels and that they are not experiencing any hypo or hyperglycemic episodes.
Okay. I think that's all the questions I have for now.
Okay. So I'll go ahead. We're going to go in and administer his insulin. Knock, knock, knock. Hello. Hi there. Hi. My name is Margaret. I'm going to be taking care of you today. I do have a student nurse with me. Her name is Dulce. Thank you. Is it okay if she comes in with me?
Yes.
Okay, so come on in. I can start with you. Can you tell me your name and date of birth?
Ronald Jarvis.
Or I'm sorry, your birth date?
I'm 67.
Okay. Go ahead and check your wristband. Do you have any allergies?
No.
Okay.
I'm getting a little tired.
You're tired? Okay. Well, I'm going to be administering your regular insulin. And since you're tired, I can go ahead and give you your long-acting insulin, the Glargine. Okay? Go ahead and raise your head. Besides being tired, are you feeling okay? So, yes, I do see the doctor has ordered regular insulin and the insulin Glargine. So that's the long-acting insulin. Are you familiar with these medications? Mm-hmm. You are, so you know about rotating injection sites. You know about possible side effects. There could be a little redness. If you don't rotate the injection sites, there could be lipodystrophy. Okay. Do you have any questions about the medications?
Nope.
Okay. I actually do have a packet here. It offers information on both of the insulins that you're receiving. So regular insulin and then insulin Glargine. So I highlighted the important stuff if you want to go ahead and look at it.
Okay.
And there also contains information about your 1,800 calorie diet. Yes, super packet. Okay. Get the regular insulin first. Now when we're administering medication, we always do safety checks. Okay. Let's see. So this is the regular insulin, the right medication. It's not expired. and it's given on a sliding scale. So based off of her most recent blood glucose level, which is 242, we're going to be administering 16 units. So it's the right medication, the right amount. We have the right syringe right here, and if it's okay with you, we'll administer it in your abdomen.
Okay.
Okay. And it is the right time. It's 2100 Tuesday. So we can go ahead and do that. Are you aware of the symptoms of hypoglycemia?
Mm-hmm.
You are? Okay. So cool and clammy. Let me turn this a little bit. I guess that's it. Oh. Well,
Is that good?
There we go. Okay. Okay, and you know not to share your insulin or needles with anybody else
Yep.
when you're administering at home. How's your wound doing?
Good.
Good. The wound nurse will be in Amsterdam to assess it. Okay, so I'm going to be inserting 16 units of air into the vial first. There is 16 units there. Their abdomen. So I'm going to inspect the abdomen. There's no redness or bumpy skin. It looks good. Cleansing the skin. How does that feel? Good. Not too bad. Now I'm just documenting what I did. glargine, your long-lasting insulin. I'll have to scan your ID again. I'm sorry, I'll have to do that again. You didn't read. Sorry, I didn't pull out the new insulin. So this is the insulin glargine. So the computer didn't take it because it was the wrong one. And it's not expired, so I'll go through the same safety checks again like I did with the first one. It's insulin glargine. It is 18 units. I have the right syringe, and we will administer it in the left side of the abdomen this time. And it's the correct time. The time is 2200, but we can administer it a little bit early because the patient said she was tired and wants to go to bed. So. Alright, I'm going to come around on your left side. Okay. Again, inspect the skin, make sure there's no redness, no bumpy skin.
Correct. Increase if it, that's right. That's exactly right. So this isn't some of the exciting things we're going to do to see if the medicines are working.
Cover your back up.
Sometimes, there's certain ones like the router or whatever. I didn't know if there was anything.
Now I'm just documenting again.
So, are we supposed to just take a couple of them and then stop? Yes, that's important. They just take a couple of them. That's pretty classic. Correct, that's exactly right. Good, that's good, okay. And so, if you were doing an assessment on somebody, what would you want to look for? To see if the medicine is working. If you had a wound and you were taking this, what would you want to see? Right. Just get some water, less red, heal from the bottom up, right?
Go ahead and take my gloves off. You still feeling okay?
Mm-hmm.
Alright, so your snack will be here soon, and then we'll let you go to bed. Is there anything else I can get for you?
Nope, I'm good.
Okay. Go ahead and lower your bed again.
What's special about that?
Alright. I will be back to check on you in a little bit. I'll see you later.
Okay.
So what do you need to take the pill with? Well,
you have any questions?
Yeah. Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, their current blood glucose level, whether or not they had any allergies, if they were showing signs and symptoms of hypoglycemia, and then I also looked at the injection site.
Did this information affect your decision to administer the medication?
Yes, their blood glucose levels are important. The regular insulin was on a sliding scale, so depending on their blood glucose level, that was the amount that they were to receive. And if they had signs and symptoms of hypoglycemia, I would have held the medication.
Did this information affect how you administer the medication?
Yes, if their injection sites didn't look good, I would have rotated to a different site and rechecked their blood glucose levels.
Okay, I think that's all the questions.
Okay,
All right, well, bye.
bye.